Start our second session titled Discussing Accessibility Challenges to Person-Centered Care for the LGBTQ plus community. And I would cordially invite Katherine Reilly. She's an author, academic lecturer, English literature, LGBTQ plus business consultant, TEDx speaker, public and motivational speaker, among other things. An activist we're all proud of. Katherine, the floor is yours.
Good afternoon, everyone. I would like to thank you for being here today. It's such an honor and a privilege to be speaking for the Inisght conference and, of course, here at ECPA. I would like to state that as a trans woman that has been striving to become a mother for the past 10 years, I have faced my share of difficulties in this country as regards accessibility and treatment in all healthcare provisions. Now, my story alone is not enough to dictate what is going on in the country and how trans as well as LGBTQI individuals are treated here. It must be noted that there's a lot of discrimination, scrutiny when it has to do with LGBTQI individuals who seek medical care in the country. Now, I don't want to tire you with many examples. However, a lot of LGBTQI individuals have approached me and have expressed their grief that they are afraid of going to hospitals. They are afraid of visiting doctors to be treated for minor issues and even serious ones. Unfortunately, this is the reality that we are living not only here in Greece, but in many European countries. Some examples have to do with broken legs, others for simple infections, but they prefer to have them, just to avoid, having treatment and stay at home. Everyone has the right to medical care, and the fact that people are afraid to seek out what they are entitled to is horrible, to say the least. Now, I will use some of my personal examples to state what is going on in this country. Some of you are aware of the fact that I've been trying to become a mother. The first 7 or 8 years, I was trying to a surrogate mother. However, the law forbid me from doing so, even though I did deposit and safekeep my genetic material at a hospital. Now, the thing is that a few months ago, the hospital told me that I am allowed to do so now because some legislations have changed. However, valuable time has passed and I am getting older. I have no issues sharing my age. I'm 47 years old. If I had become a mother at the age of 39 or 38, when it was my wish to do so, things would have been different for me. I'm not saying it's too late. It's a personal choice to be in close, proximity to my child and the age gap to be as small as possible. Therefore, I decided to pursue adoption as a means of becoming a mother. Little did I know that even though I legally have the right to become a mother, social workers, psychiatrists literally slammed the door in my face. So without getting into many details, I would like to state that when I first decided to undergo the whole procedure of adoption, I remember the legislation stated that people who are of the same gender and are in a marriage or wish to be married are not allowed to adopt a child. In my case, we're talking about a single parent family, and nothing would stop me from becoming a mother. So the law was on my side, thank goodness. Now, the thing is that even though I had every right and the privilege to become a mother, I had to visit some hospitals as the state and the legislation dictates. I remember that I had to start out with blood exams, x-rays, to see if I'm healthy to become a mother. So upon starting the whole process, my blood exams fortunately were great. My health condition was perfect. And the person in charge of the hospital, so she told me, I'm scared of putting my stamp on your documents. And I told the person in charge, but you're the supervisor here. Aren't I healthy? Yes, you are. but I'm scared of the backlash that I would receive for granting you permission to move to the next step of the adoption process. Now, legally, she should have complied right away and put her stamp, but she was terrified. So this is another thing that I would like to state, that in this country, people are afraid to carry out their legal duties because they are afraid of how the rest of society would react. In the end, I'm not going to say she gave in, but she knew I really wanted it, and she gave me her stamp and signature of approval. After the hospital examinations, I was obliged to visit a psychiatrist. So after waiting 3 months, because I had to book an appointment, I showed up at the appointment at a public hospital. The woman examined me, and she stated that I cannot carry the burden of being the psychiatrist that will grant you the right to become a mother. I can't take that burden on my shoulders, so I will not sign the document. So I asked her, aren't I healthy mentally? Do I not have the capacity to become a mother? Can't I adhere to the responsibilities of becoming a parent? She said, yes, but I'm not taking that responsibility. And she told me to go. I left the hospital in tears. After that, I remember that they called me and they said, we're going to arrange another meeting with another psychiatrist. We did so. I waited patiently for another appointment. And the psychiatrist told me that based on his own personal principle, he will not sign the documents because he stated that I do not believe that a trans woman should become a mother. Now, all of these employees, because we're talking about public servants, civil servants that are working for hospitals, they did not wish to carry out their legal duties. They did not carry out their obligations as doctors because they have given an oath to help serve and protect their fellow human beings. But they were terrified or they were indifferent to my wishes to become a mother. So I'm using just one example, expressing my own personal experiences. After this occurred, I remember that many trans individuals, LGBTQI individuals, started sending me messages on social media. I visited a doctor because I had a cold, and he didn't even examine me with his stethoscope, or he didn't even ask to have an x-ray. He just disregarded my presence and told me to take some medication. Or other doctors didn't use the correct pronouns and they insulted me, even though I kindly asked them to respect my gender. Another issue that is going on in this country, since we're talking about pronouns and gender, there are many individuals that identify as non-binary. They don't use the pronouns he or him. They don't use the pronouns she, her. They are they, them. Many doctors are ignorant and do not understand what it means to be non-binary. There are many doctors, and I know this sounds horrible, that do not recognize what intersex is. There are many doctors that do not comprehend the fact that a person who is in transition can be in transition for years. What does that mean? That, for example, myself, I decided to follow the life that I choose, and I want to be myself. I want to be Katherine. Having said this, I can't wake up one morning and say, okay, my life has changed, because you have to change your ID, your documents. You have to inform your employers that, you know, I'm going through a change in my life. So when you present yourself to the doctors with an ID that has a different gender than the one that you acknowledge yourself as, and you kindly ask the doctor to respect your wishes because you still haven't changed your documents, it takes a long time in this country. And they say, I don't care what you ask me, but that's what the ID says, your identification card, and that's what I'm going to follow. So upon first glance, you can realize that everyone is terrified. They feel uncomfortable in the presence of doctors and hospitals and the staff. I remember when I started my transition, I started my hormone therapy. My hair grew longer. Long hair doesn't mean that you're a girl or not. You can even shave your head. But at the time I was transitioning and I still hadn't changed my documents. I had to visit the hospital back then because I had an accident with my knee. And I remember the orthopedic said, would Mr. please enter the room? I didn't raise my hand, I didn't get up. After he said my dead name a second and third time in front of so many people, I kindly went to him and I said, "This is the person you're referring to. Could you please use female pronouns?" And he says, "This is not a game. This is the papers I have. Do you want to be examined or not?" So he humiliated me in front of everyone. I'm trying to be very discreet with the vocabulary I'm using because he used quite colorful vocabulary to speak about people like me. These are just some of the experiences and what's going on in Greece. Now, there are wonderful conferences such as this. There are private initiatives. There are doctors who care about their patients. Yes, there are doctors who try to be informed online, but this is not enough. Education must be mandatory. We should oblige doctors, even if it's for 1 hour, 2 hours, to learn the basics of what it means to treat people who are LGBTQI. And as for the legislations and everything that's going on lately, the last few weeks here in Greece, because we've been talking about marriage between same-sex couples, we've been talking about adoption. Right now, there are literally dozens of couples in Greece that have been married abroad, they have children, and their children are not acknowledged. What do we mean by this? People who have been married abroad are not recognized by the Greek government as couples. Therefore, one of the two parents is not recognized legally. So if, God forbid, something happens to the parent who is recognized legally, the other one cannot take care of the child. Actually, there's this huge company, an international company, and they're two wonderful mothers. They have their daughter. One of the parents is actually recognized. They had to travel abroad. They came back to Greece. So they actually accused one of the mothers for kidnapping, which is horrible to say the least. And the child was clinging onto the mother. "What's going on, mom?" So you can also imagine that the child was traumatized. You have no say in healthcare for the child, anything that has to do with education. You want to go to school to pick up your kid, but one of the parents is only acknowledged as the actual parent. And these are things that have to change in this country because it's not only healthcare, it's how we respect one another socially. And you know what? It's not only about respecting one another. It's about dignity, who we are as human beings and the legacy that we will leave behind us for our children and our students. I am proud to say that I am a teacher. I've been teaching for the past 23 years. My students love me. It's a privilege. It's an honor. I was on national TV yesterday talking about the right to motherhood. So as soon as I went back to school to do my lessons, two of my kids ran onto me and they hugged me. And they're like, "Don't worry, miss. Even if they don't give you a kid, we'll be your children." So I started crying in front of my students. And I am fortunate because I do have people in my life who love me. Not everyone is fortunate. Not everyone has that privilege. Not everyone has the courage to go to a doctor because usually 50% of cases, statistically in Greece, end up with hate behavior, being sidelined, or in many cases, being verbally abused with horrible pronouns and, words to describe who we are. I can keep on going, but I don't want to take up most of your time. I just ask all of you here today to love the person who is next to you. Try to be courteous, sympathize with one another, and try to change the world. My students are scared of what they see every day on TV. My students find it incomprehensible that things like this are happening in Greece. And my kids are 8, 9, 10 years old. Some of them are in high school. I'm not saying that we are bad people. I'm just saying that maybe, just maybe, we should look in our kids' eyes and see what the truth is, that regardless of color of skin, regardless of gender, regardless of sexual orientation, regardless of origin, nationality, anything, we all carry the same blood inside us. We're all human beings. And that's what I want you to keep in mind after today's conference. Thank you all so much for being here today. Thank you.
It is always very difficult to keep on a conference, a meeting after Catherine has spoken. We don't have words to thank you enough for depositing your experience. And I know that you have been heard today. So moving on.